Diagnosis of heart failure in pregnancy. Good morning and welcome to today's episode of Heart Failure in Pregnancy, where we learn how we confirm heart failure in pregnancy. When a pregnant woman or postpartum woman shows possible signs of heart failure, time is critical. Early diagnosis saves lives for both mother and the baby. Evaluation must be urgent, thorough, and guided by specialists. Here is how we begin the diagnostic journey of heart failure in pregnancy. Number one, a thorough history and physical examination is the first and most crucial step. Before any tests are done, the clinician must assess the symptoms. You ask about shortness of breath, orthopnea, PND, swelling, discomfort. Assess for risk factors. Do they have hypertension, preeclampsia, anemia? Is there past history of heart disease? The timing, when is it occurring? Early pregnancy, late pregnancy, or even in the postpartum period. That gives a high index of suspicion. Assess the vital signs. How is the BP? How is the heart rate? How is the saturation? Check for evidence of congestion, a raised GIVP, leg swelling, abdominal swelling, and a thorough cardiac examination. Is the apex displaced? Are there any murmurs? Are there any crackles? This guides on the urgent testing that needs to be done. Number one is a chest x-ray. I start with an x-ray because it's accessible, it's fast, and it is safe with abdominal shielding. An echo may not be immediately available, and most facilities have a chest x-ray. So an x-ray can quickly reveal an enlarged heart. It can show pulmonary congestion, pleural effusion, or even Kelly-B-line signs of fluid overload. A chest x-ray is safe in pregnancy with proper abdominal shielding. You must always shield the abdomen in a pregnant lady who is being done a chest x-ray. Number two, the echocardiogram. This is the gold standard for diagnosing heart failure in pregnancy. Echocardiogram. An echocardiogram provides the most accurate diagnosis of heart failure in pregnancy, and it is safe both for the mother and the baby. It assesses the ejection fraction, the pumping strength. It shows chamber enlargement, the heart muscle function, the valves, and pulmonary pressure. It confirms severity of the heart failure and guides treatment, and also guides on diagnosis of peripartum cardiomyopathy. The other test that we do is an electrocardiogram or an ECG. This is useful in identifying arrhythmias, conduction delays, signs of cardiac strain, or even chamber enlargement. So echo and ECG, very key. Then we have the blood test. And one of the most important blood tests, which we had discussed earlier, is the BNP, proBNP, brain natriuretic peptide. This is a key heart failure marker, which is elevated in response to stretch. So a BNP, if available, should be done with every patient with heart failure. Troponins are also done. They show myocardial injury. And other supporting tests like a hemogram, a thyroid function, a kidney function test, basically routine tests to support and guide in the management. Remember, heart failure in pregnancy is a high thromboembolic risk. So you should always assess for thromboembolism. And if needed be, you may need to do other tests like Doppler. Other tests are done as required. So the key tests will be your chest x-ray, your echocardiogram, your ECG, and your BNP test. The pregnancy heart team is very key. Diagnosis must be coordinated by the cardiologist, the obstetrician, neonatologist, and anesthesiologist to ensure safe, holistic, and timely care for the mother. Early detection is equal to better outcome. We do not wait. We do not guess. We assess, confirm, and act fast, both for the mother with the baby in mind. So stay tuned for the next episode tomorrow, where we learn more about peripartum cardiomyopathy, one of the commonest causes of heart failure in pregnancy. Remember to keep your questions coming on heart failure in pregnancy. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.